And I'm not here saying that vitamin D or lack thereof is the reason why black people get cancer, prostate cancer. We're not saying that. What we're saying is that the reason why you're more likely to get it, the reason why there's a higher incidence of these cancers in our population is because we are not getting enough vitamin D. We're not getting enough sun. And your skin can make by far more sun, more vitamin D than you could possibly supplement.
What about a sun-filled room versus being out in the sun? Can you get the same benefit from a sun-filled room?
You can if it's not a room that has a window or a screen that's filtered from ultraviolet D rays.
Most office buildings, they have that?
The modern ones, yeah. I mean, you know, even if you go to Home Depot to buy a window, right, that's a selling point. The selling point is this window is going to block off ultraviolet rays, both A and B. They make a point. It's a selling point. These are the. You can pass these out. Just kind of pass it down. This is not all the research that, and I want to first of all start out by thanking Baba Lumumba for the major significant role he played in the research itself. There's a lot of data there. That first page is really the takeaway. We went through a lot. And we started out dealing with anthropology, and ended up dealing with vitamins and the politics of it, and health, and that kind of summarizes the key points. But this is the key references that garner this information, and I encourage you to follow up. Don't just take my word for it. The information is out there. It's very, in the information age, it's very difficult to hide anything from anybody. So I encourage you to check up on what I'm saying. Don't just take my word for it. I'm simply putting it together, but the information is out there. And also, I'd like to thank Baba Imamu for trusting me to put this thing together. To put together for this particular program, just from the idea that we know that this information is vital to our people and they're not getting it, and nobody has made the connections. These are connections that need to be made, and nobody has made those connections. So I trust him thank you for trusting me to make those connections. And of course, I thank you all for listening. And I'll take any further questions you have at this time. I will say one thing. Vitamin D, as I mentioned earlier, is an oil or fat soluble compound. What that means is that it can stay in your body for a long period of time. Basically, it's comparable with your fat cells. So what your body doesn't use, it will store. So you can actually have large stores of vitamin D in your fat cells. If you get a lot of sun for a certain period of time and you're chock full of vitamin D, your body is not going to just excrete the rest of it. It's going to go in your fat cells, and it'll excrete it as your body needs it. So that's also something very important to know about. It's been demonstrated to store for months, and I think that's how it appears to be designed to work. We have different seasons, and some seasons have more sun than others. So you get the right sun at the high seasons, and your vitamin D level is not static. It depends on the weather. It depends on, even as little sun as we get, it varies how much sun we get because there's less sun where we are. So there's a variation. It's low, but it varies nonetheless. But it does store. So even though you get more in the summer, you're gonna have more of it available to use in the winter months, where you're not only are you indoors more because it's cold, but you're also wearing more layers of clothes. So you're really getting
Yeah, that's what I was going to with the layers of clothes. You go to the beach, right? Of course, most of your body is exposed. Legs, chest, your arm, whereas if you walking around in sun with clothes on, you're not going to absorb as much, right?
Right. Right. And
Clothing, I guess, tends to block.
well, yes, clothing will block. For the most part, the largest organ in your body is your skin. Right. We learned that. So. But your skin is covered up most of the time, so mostly it's your neck and your head, your arms, so forth, where you actually have, and that's really not a big part of your body, you know. So obviously, you know, I'm not saying walk around naked, you know, but the clothes.
Have more beach parties,
Right. But
there's going to bar. If in fact it doesn't rain.
Right.
Dropping lobster.
Okay, no problem.
Oh, I know. So is there a side effect from taking vitamin D2?
There haven't been demonstrated side effects other than, you know, you do have to allow this compound being kind of moving throughout your body without it being used. We haven't seen any definitive side effects from vitamin D2 as opposed to vitamin D3. It hasn't been shown to be detrimental. It just doesn't function as well until it's doing what it's supposed to do. But it might come out later on that it does have an effect, but right now it hasn't, research hasn't.
It's go 30 years before you know.
I mean, these compounds can stay in your fat cells for a long time. It may take a lot of time to see, because your body doesn't, it's like, when your body makes something, then you know your body can process it. When your body has something in its natural state, you know, when we were where we came from, right? You know, if your body had that compound, then you know your body can process it. That's what Sister was talking about, fluoride in the water. Fluoride is present in natural water, spring water. You get a borehole, and you dig it down, you pump it up, it's going to have fluoride in it. You know, if you're in a geographically favorable place, but it's natural. Our body naturally makes this type of vitamin D. So our body is designed to use that. It can make a substitute, but it's nothing like the real thing.
And maybe living here, this side of the world, we are not going to get enough by natural sources of the sun, by our exposure.
Unless you can, but you have to make a concerted effort to get a lot more sun. Right. You cannot listen to the device telling you not to get in the sun.
You said go out there naked and
There you go.
Don't
say I tell you go out there.
Doctor told me to do it.
Right. But definitely, you know, get as much sun as you reasonably can.
No, you have to maximize your surface area coverage.
Right. As often as you can.
But if you're in your own property,
Okay.
Okay. I just had a quickie. Can you dilute the D3 in liquid?
Right.
I've done it and I don't know
Right.
how you've been doing it.
Yeah, you can put it in food.
It's kind of strong.
I mean, I don't find it.
I do 10
we all
drops.
take
Oh, okay. 10 drops is a lot, but that's still fine. You can put it in food. The recommended to the USDA recommends 600 units, which is really pitiful. But the least I would recommend is at least about 2,000 units.
Yeah.
You can put it in food, you know, as long as you're ingesting it, it doesn't really make a difference how you in water. It's kind of an oily substance, so I admit it's not going to mix well with water so much. Right. You can put it in anything that.
We can put bananas on and wow. Yeah.
Right, but straight water, you may have a mixing problem. Before I finally close out, I do want you to look at this picture right here.
Yeah, sunrise.
Who's this? No.
Oh, that's
Imhotep.
Osiris. And who's this? Anybody?
Which one? Where are you?
No, not Ra. Right, Atan. It was an aspect of Ra that separated, but this is essentially the sun and its rays. And anybody tell me what these little symbols right here? Life. So this is our ancient selves. This is the God of the perfect black. And he is giving homage to the sun rays, which are giving life. Back then, we recognized that life itself comes from the sun.
Come on, brother.
And this is, I mean, I'm not going to tell you how old this is, but we've known this for a long time. We need to remember what we used to know. And I thank you all for allowing me to share with you.
Thank you.
You did a great job. And you did. We learned something we didn't know before we walked through that door. I know I did.